What resources do I have to use? Should I take notes on everything? Should I take notes in the first place? Should I do this? Should I do that? Breathe. All these different questions you will have before you enter med school. Medicine is an art. Medicine is beautiful. Having the right tools and the mindset is essential. And so, let's get you ready for med school. Incorporate X into your learning. Before I reveal what this thing is, let me ask you a question. Do you want to remember what you study? And obviously everyone says yes. But 75% of the information we learn in the first month is gone. When you first learn something new, obviously at first it's at 100%, right? So, as the days go by, what happens to it? It starts to dip, you start to forget. The best case scenario is trying to find a way where as soon as you start to forget this information, you review it again and again and again, so it remains at what? 100%. It would be amazing if you can do something like that, right? Because you remember what? The majority of your information. What if I told you there is something that you can use, that you've heard about before, but you never tried, that can change the way you study forever? And it uses an algorithm that knows that you will start to forget it, so it gives you the information to review. I am talking about flashcards. You might be shaking your head right now. After all this, I waited for flashcards? Yes. I am a mad advocate of flashcards. Why? I've made more than 7,000 cards, and I can tell you, I remember a lot of the information I studied in first year because I used flashcards. I used spaced repetition. When exam time comes, you don't have to review a lot of things because you already practiced a lot doing your flashcards every single day. So incorporate flashcards into your learning and you will never regret it. Second point I want to talk about. This is crucial. I see this all the time in med school and it's so disheartening. An average doctor studies for grades. An exceptional doctor studies for patience. If you have a mindset, I need to score the highest grades and it will make me an amazing doctor, you have it wrong. You can memorize all the information that you want, just randomly memorize it, not understand it, not go through it. You go to the exam, you regurgitate all of it into your exam, and then you forget about it. Then how can you produce actual good treatment for your patients? I'm not saying that you shouldn't aim for high grades. I'm not. I'm saying don't let it drive you. What should drive you is your patience. It's as simple as that. Your mindset should be, how can I apply this knowledge that I learned to my patients in the future? So always study for your patients. Third point, very important these points. Do not delay clinical experience to the third year. Again, I wish I knew this in my first year. In Robert Greene's book, The Mastery, this is a very good book for anyone to become exceptional in their field. He says Michelangelo, Da Vinci, Oprah, all these different people, they had what? A mentor early on in their career. What am I trying to say? Well, think about it. Nearly all UK and US medical schools have clinical experience in the third year because they want you to build a basic sciences foundation, right? Well, you can learn the basic sciences, but you can also see patients. And this is where I urge every student to find a doctor to shadow. Sit down with them and absorb everything they say. Drugs, diseases, x-rays, it doesn't have to be in the curriculum. Learn it because you're gonna use it later on when you become a doctor. These are very important concepts that you don't need to wait for in the third year. You will be miles ahead of everyone and you will be far better when you start your career as a doctor when you shadow a doctor early on. When you have a great teacher that is teaching you, do this, do that, your learning experience is far more enhanced, especially if you're alone. You know, remember, medical school, you're probably in a group of 6 or a group of 5. You don't really get that one-on-one time with the doctor you're trying to learn from, right? But what if I told you got that time and you would learn and you would absorb and he would be focused on you and he would teach you? It's different when it's one-on-one. They can show you more things, you can do more stuff because there's no added pressure of peers as well. Okay. The next question that would pop in your mind is, where can I find a doctor like that can take me and teach me? Think about it. You're in medical school. You're surrounded by doctors. There is a very, very high chance that you will at least find one doctor that is happy to take you and shadow him or her. If you go to one of these doctors in your medical school, you ask them with sincerity, I want to learn from you. From your experience, from your knowledge, and I can work for you if you want, I can do certain things, minor tasks. And most often they will say yes. And you would shadow, and you would do it again, and you would do it again, and you will see yourself transform. For me, I was lucky. I stumbled upon a doctor who I call my big brother, and he is incredibly good at what he does. Okay, so don't delay your clinical experience to third year. The last point I want to talk about is learn to communicate well. Communicate well, what does that mean? That's very general. Well, let me explain. I made a small calculation. Let's say you have around 30 patients a day, 5 days a week, 10 months a year and you work for 40 years as a practicing clinician. You know how many patients you will see in your life? 240,000. And if you don't know how to properly communicate and build rapport with your patients, then these 240,000 will suffer. I know it's a great responsibility, but that's what we signed up for in medical school. If you have 10 out of 10 knowledge as a doctor, but you only communicate at a standard of 3 out of 10, what do you think your patients will see you as? I'll let you answer that question. And you will probably ask, but I'm shy, I don't know how to improve my skills. Well, let me just give you a few things that you can do. The first thing is imitate. Observe how good doctors talk to the patients. And this is assuming that you shadow them and you see them in the medical school as well. Observe how they talk to the patients. Take one thing from that doctor. Observe another doctor. Take another thing from the doctor. Do that for 4 or 5 times and sprinkle in some of your personality, and then you will have an exceptional communication style that is unique to you. Because we human beings, like I said, we learn from seeing. When you're a child, you learn from your parents. You would look and you see, oh, this is how this is done, and you would do it. The second point, raise your voice. Please, raise your voice. You will most likely, out of these 240,000, have patients, elderly patients, that have problems with their hearing and they can't hear. So raise your voice, because you might compromise their treatment because they can't hear you. Plus, raising your voice will make you sound more confident. If you are more confident, then people will perceive you as more competent. Third point, get on a stage. Why? Because when you get on a stage, if you're shy, you would overcome that shyness and you become confident, bringing back that second point. And 2, communicating your ideas. Because when you get on a stage and you communicate your ideas, it is very similar to what you do in the consultation room. You take a certain number of ideas and you present them to the patient. I gave many different speeches and presentations, and it made me much more confident and able to communicate my ideas effectively. That's a wrap, guys. Thank you very much for watching the video. If you made it this far, I would really appreciate it if you can like and subscribe for more content. And as always, Assalamu alaikum